residents from around the world. I'm your host tonight, Tung, from the American Society of Plastic Surgeons International Resident Forum podcast team. This podcast is an official platform directly organized and supported by the American Society of Plastic Surgeons, created to spotlight global voices in plastic surgery. It is a place where we share your life stories, your professional journeys, and the issues, challenges, and concerns you believe deserve to be heard in our global community. If you're interested in sharing your story or perspective, please feel free to reach out to us at aspsirfpodcastteam@gmail.com. Today is the first day when Taiwan enters Chinese New Year. Happy Chinese New Year, everyone! Whatever happened yesterday was last year. It is time to look to the future. Now, I'm sure a lot of you are thinking about aesthetic surgery for your future. How to get there, which surgery to pick, and why. Do I go for the breast, the face, or the body contour? Who do I learn from? Where do I start? Let's look closely at our future together today. Today, we have invited a Nigerian plastic surgeon who has completed residency training and is now practicing as an aesthetic surgeon in Nigeria. Today, we have invited Dr. George Onyejekwe, a board-certified plastic surgeon and a fellow of the West African College of Surgeons, who is also a well-trained American board-certified plastic surgeon and also a peer review in the PLS journal. Dr. George, can you take the floor and maybe start with introducing yourself?
Thank you very much, Edward. It's a great pleasure to be here and to join you on this podcast. Permit me to say Happy New Year to you over there in Taiwan.
Yeah.
Thank you very much for having me. Okay, so by way of introduction, I am Dr. George Onyejekwe. I am a fully trained and certified plastic and reconstructive surgeon. I practice here in Nigeria. For those who do not know, Nigeria is the most populous Black country and the most populous country in Africa. We are located in West Africa. So after medical training, which was 6 years medical school training, I went on to do what we call the housemanship, which is 1 year rotations in all clinical specialties through surgery, internal medicine, gynecology, and pediatrics. Then after that, I wrote a series of qualifying exams and residency interviews, and I got selected into plastic and reconstructive surgery residency training, which was a 7-year training at the National Orthopedic Hospital in Lagos. Lagos also happens to be the most populous city in Nigeria. Okay, so that was an integrated training. The first few years were dedicated to, first 2-3 years were for general surgery, urology, and some plastics. And the last 4 years were dedicated strictly to plastics and reconstructive surgery in graded levels of exposure. I completed my training in plastic surgery in October 2022. And after that, I worked for some few months in the hospital where I trained before I then joined an aesthetic practice as a fellow. So I did a 15-month fellowship really in aesthetic surgery, which encompassed here in Nigeria, which encompassed all aspects of plastic and reconstructive surgery, largely body contouring and breast aesthetics. After I had completed that, I also had the great privilege of getting an aesthetic fellowship also in the United States at the Georgia Plastic and Reconstructive Surgery Center in Atlanta, where I spent a couple of months in Atlanta also refining my skills and my training under Dr. Stanley Okoro, a double board certified plastic and reconstructive surgeon in Atlanta, Georgia, USA. Within this period, I was also privileged to be awarded the SESPRS International Traveling Fellowship to attend the Atlanta Breast Surgery Symposium in Atlanta. And that was also a very great moment where I was exposed to great mentors. Presently, my practice is in Lagos and also Abuja, which is the capital of Nigeria, and focuses largely on aesthetic surgery, about 90%, and then 10% makes up reconstructive plastic surgery. Thank you.
Wow. Wow, that is just a lot of traveling. You are traveling like the Olympic champion. Like you are. I think you are pushing pretty hard for yourself, which is great. And I think like all of this is like you have a it sounds like you have a clear vision of yourself. Like, did you envision yourself going onto this career path like right in the beginning when you start your first year of residency?
Well, it wasn't clear from the very beginning the exact path I would take. I had broad interests in different parts of plastic surgery. I also completed a master's degree in bone care at the Queen Mary University of London, which was intercalated with my residency training, and we had exposures in London. So at that point, I was drawn a lot to burn surgery and at some point also to reconstructive microsurgery. And I kept my options open also, looking at the opportunities that were available. And at the time I had finished training, I was thinking really towards the end of my training that I would go into reconstructive microsurgery with opportunities and all of that. But there weren't available fellowships at that time. So I would say that it was by serendipity. I found myself in aesthetic surgery, and it's been a beautiful ride since then.
Well, well, and was it hard for you like to trying to do all this international go about? I'm sure like financially it would be difficult, right?
Definitely, it's difficult. Also, looking at the exchange rate for of the naira, which is our local currency, to the dollar. I mean, and then the amount of money it takes to plan all these trips is it's something that is really difficult. But I've had a lot of support by my hosts, the ASPRS, also supported with the fellowship with some funding. Also, my host in Atlanta also supported. So it's been goodwill and training, and of course, I think that if you open up yourself to opportunities, the world has a way of also helping you. So it's been a lot of planning and saving and working towards these goals, but now it's really paying off.
That's a very well put and very well connection back to like the SPS community, how like this is a great platform where we can offer some opportunities to people who actually wants to get started, you know. And I just have another question that I think we can take a step back. Like, do you, since now you have already traveled to, I think you said like UK, Atlanta, different places. Like, do you think as a aesthetic surgeon, it is necessary to gain international exposure to either connections or technical skills or like educations wise, or you could just do all this with like online learning and just back home?
I would say most definitely it's helps to travel. Okay, when you travel, you get new perspectives, you are able to refine your skills. There is always something to learn from someone. And from my travels, I've learned a lot. I've refined my skills. I've become a better surgeon. I've, gotten a more global perspective of things, the differences in the way we practice, differences in the system, how to approach patients better, and how to plan the surgeries better. There's always something to learn when you travel. So I would say that my opportunities in Atlanta with the breast surgery symposium and with the fellowship and in the London have been great game changers for my practice. And I continue to be grateful, extremely grateful for the opportunities I've had to learn from multiple mentors along the way.
Can you tell us like some significant stories you had back there in Atlanta that really give you some inspiration from for your journey like all this way?
Definitely, yes. There's a lot of inspiration that came from my travel to Atlanta. One of them is, of course, at the center where I was training, happened to be the training center for the use of radio frequency devices, the body tight device, for skin tightening technology. So this is not something that we have readily here in Nigeria. And I was lucky that when I was there, there was also a training organized for surgeons, plastic surgeons from across the United States who came around to the center to learn. So I was able to join in these training sessions. I was exposed to non-surgical or minimally invasive skin tightening with the use of radio frequency techniques, micro needling techniques. These were great exposures. And of course, exposure to other surgeries that have not become really mainstream here, facelifts and rhinoplasties that we're beginning to build upon back here in Nigeria. All this made it fun. And of course, the whole experience in Atlanta outside of work, meeting people, getting to visit places, getting to the Mercedes-Benz Stadium, and just experiencing just taking it as a whole experience, not just medicine, also made it all the more worthwhile.
Like as an international trainee who is, trying to get education in a foreign country, was it like hard, or like was it very supported by your surroundings?
Yeah, so it was very supported. I got a lot of support, of course, starting from my family. I had to make a lot of they had to make a lot of sacrifice to have me travel frequently. So I would say that I got a lot of support from my wife, and who was able to take care of my kids. I have mentors locally who always say to me from very early on in training that I must factor in traveling outside of the shores of Nigeria at every given opportunity to learn, especially after training. They made it very clear that it was a path to knowing the world and to learning new skills. One of my mentors, who is a reconstructive microsurgeon, travels frequently to Taiwan, to China, even up till now to advance his skills, to learn new techniques, to continue to improve himself in his field. So I think that that was an inspiration for me. So I already knew very early on, because of this kind of mentors, that this was something that was non-negotiable to make me a well-rounded surgeon back home.
Wow, that's a very, very, very good mentor in the early back of your career life. It's like when you factor in this is part of your daily life, you just gain a lot more than others, I'm sure. Yeah.
Definitely, yeah.
So, I'm curious, like, is there a view of the differences in beauty wise, back in Nigeria compared to, what you learned in Atlanta? And how do you cope with it?
Yes, that's a great question, everyone. So there are different beauty standards in terms of aesthetics, and it's all about balancing. Back here in Nigeria and in Africa, especially for body contouring, Africans tend to be thicker, and they tend to love a lot of significant curves, if I would say that, especially when we're performing 360 liposuction and Brazilian butt lifts, for example. They want more prominent projections for the hips, for the bottom area, and all of that. Very narrow waistline. What I saw in Atlanta was more of abdominal definition and not so much of fat transfer, just moderate fat transfer. Okay, so these are some of the minor differences. Also, in terms of breast aesthetics, people back home also tend to go for really a moderate to large volumes, whereas some demographic back then in Atlanta wanted just something moderate and all of that. So these are things that one sees along the line and then has to adapt his or her practice depending on the demographic of those visiting his or her clinic, wherever the person finds themselves.
So how do you adapt like the differences since the way how you learn in Atlanta and then you kind of had to adjust it back home in Nigeria, and since 90% of what you do is aesthetic surgery, like how do you go about your learning and how do you cope with the differences?
Yeah, so it's a continuous learning and improvement. And of course, before I went to Atlanta, I already had some experience, some rich experience in Nigerian aesthetic industry, so I wasn't particularly green. So that gave me a foundation. I already knew what Africans and Nigerians would like aesthetically. So coming to the United States, and I saw slightly different, some slight differences in what they focus would be in terms of the aesthetics was a kind of an eye opener, and that's made me realize that culture and all that plays a role in the way we approach our patients, and also one has to be culturally sensitive, emotionally intelligent to practice in a way that fits the person's environment. So that has been the learning point from that for me.
Mm, okay. Well, like, can you tell us about like the aesthetic surgery society, like, or the current situation that you have in the market? Like, what's the most demanded procedures that you normally do, and like, what's it like there?
Okay. So yes, so the aesthetic procedures that are most common here in Nigeria include one, liposuction, that body, tummy, flank, back liposuction, and fat transfer to the hips and the butt, which we call the Brazilian butt lift. This is one of the most common procedures requested here. For patients who have completed their family size, usually middle-aged patients or young to middle-aged patients after completing family size. The tummy tuck lipoplasty comes in next. Then a lot of breast surgeries, especially breast reduction for patients who have very large breasts, and of course augmentation for those who have really small breasts. Then breast lifts and plus or minus augmentation depending on that all the particular anatomies and the needs of the patient also coming as maybe a third or a fourth. Facial surgery is also gaining traction. There's a lot of non-surgical facial procedures which we perform: the micro needling, radio frequency, skin tightening, Botox, and fillers for the face. But people are now beginning also to request for facelifts and rhinoplasties. So these are emerging areas in the market for Nigeria and Africa as well, Black Africa.
Well, there are a lot of procedures and surgical procedures like you have just mentioned. Like, I think you have been practice in aesthetic surgery training for about 3 years or 2 years
Yeah.
and a half.
Yes.
Wow. And like, so did you learn all these procedures in 2 years and a half, or just, it was provided during your residency training back home?
Great question. So there was what I call a graded and graduated exposure to aesthetic surgery training during residency, and I started actually getting exposed to these procedures. The center where I worked after I left residency, I had started shadowing and visiting and participating in surgeries even as a as a resident doctor before I finished residency. I also had the opportunity of traveling to, this locally anyway, within West Africa to Ghana, a visiting country where they also have a large volume of aesthetic surgery incorporated into the residency training. I was there for about 4 months, and that I also was exposed to a lot of liposuction procedures, abdominoplasties, breast surgeries. So all this had formed some form of foundation for me that I then built upon after finishing residency. So I wasn't completely green with regards to aesthetics once after residency training.
Right. So, wow. Like, would you say you kind of know all these procedures, or just like able to, provide the services? Like, um, and I would also know, like, do you think this is the scope where you will be going for your career, or do you think eventually you will be targeting more specific surgical procedures, like, for example, just the breast or just the liposuction? Like, I'm curious to know, like, how do you think the scope of your career life is? Is it to maintain multiple procedures, or to be specialized in one or two?
Great question, Dr. Edward. Yeah, so for now, try to keep it broad based, which I have also seen. I've spoken to mentors, and I find out that most of the people who have narrowed down later in their career also started quite broad based. Just like every other thing in my career, nothing has been quite certain from the onset. Like I'm saying, I was almost certain during my fourth, fifth year of residency that I was going to reconstructive microsurgery. But here I am talking about aesthetics. So I just keep an open mind, look at the opportunities I have, the threats to those opportunities. I'm open to learn. I'm adaptable at every point in time. For now, I will keep it broad based. My what I'm looking at in the future, just like you mentioned, is to narrow down and to maybe just body contouring, which is an area where I have a lot of passion for body contouring and maybe some breast procedures. But for now, I even take on reconstructive surgeries and I get called upon because there are just very few plastic surgeons if you compare to the entire population. So I get also a lot of calls for reconstructive procedures, emergencies in surrounding hospitals to help out and all of that. So it's pretty much broad based aesthetic wise for now, but I hope to narrow down in the later
Mm,
in future. Yeah.
mm. Yeah, well, well said, well said. Yeah, like I think that is a very the scope that a lot of people is planning to do, to start with the broad base and to narrow down eventually. Why did you choose the body contouring, like you mentioned, would be your favorite?
Yeah, so it's my favorite because I'm able to make a dramatic difference for my patients. It's when I'm performing. I think one of my best procedures would be a tummy tuck. So I never get tired of performing one because I love it. I'm happy to see the immediate dramatic transformation in these patients, and they feel very happy and confident in themselves when they come for their follow-up visits. I see patients who come in for their consultations looking bit downcast and anxious. We talk through the entire process. I reassure them they have got abdominal bulge, their body has suddenly changed following multiple pregnancies and all that. And then when they go through the entire process, they come in for their reviews and they're looking great 3 months, 4 months down the line. It's always something that gives me a lot of joy. The difference is usually quite dramatic, and I think that is why I love body contouring.
Mm. I think you mentioned something important. You mentioned about your joy, and I think it's important to for me to differentiate, like in your career life or in this 2 years and a half of your training for aesthetic surgeon. Like, do you think you have be aligned with the, I would say, the customers or the patients, like their sense of beauty, that you're aligned with what you think is successfulness for your outcomes. Like for example, like have you ever experienced lawsuits, like for a surgery like you have done for a patient before, and it really hold you back with your career, and made you reflect about whether you want to continue with this career or not?
Okay, thank you. So, luckily, I have not had any lawsuits or any severe negative or adverse outcomes, and that's I'm very grateful for. I'm also very heavy on patient selection, um, and also working with the hospitals, my team, and all of that to make sure that every aspect of the care is standard. And that is one of the things also I would reflect back about my experience in the US and the UK, where all this patient care information and all that is advanced. So when patients come to the practice here in Lagos, they get the full information. There's nothing hidden about any surgery. And I think that when the patient is carried along most of the time, told everything to expect, and when you under promise but try your best to over deliver, that you tend to have patients who are largely satisfied in the end. Has it been all rosy with all patients so far? No, there have been patients that have not exactly we have not exactly matched their expectations despite our best effort. They are in the minority, but also the way we manage it. And this is also part of the entire experience I've had in the training exposures I've gotten from my mentors locally and internationally. The way you also approach problems is also part of it. So reaching out to the patients, discussing if there are any complications, helping them through the management of it, and seeing them through also helps with the entire process. So I think that has been helpful so far, and I hope to keep it that way going forward.
Well, I think that really well said. It's like I think instead of like defending for yourself, you are really being responsible for the patients to see how to fix it and try to care for them with their emotions and with their aesthetic outcomes. That's really well said. I want to know, like, since now you said you have also been involved with the SPS, and how do you think the Nigerian residents or the international residents can, use the resources for international platforms like SPS or the fellowship program, the like Atlanta, like all this route. How do you think you can use these resources to help the future residents, and how you can instruct or advise the residents to use these resources, to become where you are right now? Because I think where you are right now is a very successful place where you are. It seems like you have gone through a very hard battle, like 6 years of residency, and then you had to travel to UK and Atlanta. Like, can you like I'm just a resident now. I'm not. I'm looking at you. So like, can you give me some guidance, like how we can use all these resources and what you can bring back home?
All right. Thank you very much, Dr. Edward. I appreciate that. Yes. So the ASPS offers a lot of opportunities for residents, one of which is this program, the podcast, which you're doing. And I must salute you and the entire team for a wonderful job. So there are lots of opportunities in the ASPS and its associates bodies that people can benefit from. For example, the PRS journal, which is also affiliated to the ASPS, is a journal that offers residents the opportunity to be resident advisory board members for the journal. So you participate in journal clubs, you review articles for the journal, and you promote the activities of the journal. When I was a resident, I was a member of the PRS the PRS team, okay, for Residents Advisory Board. That's what it's called. And I was there for about 3 years till the end of my residency training. And I had the opportunity of networking with residents from across the world, and it opened up opportunities also for me, which I'm enjoying now. You also have access and the opportunity to contribute to what we call the spotlights in plastic surgery, where they send different articles and journals to the residents that are interested. You go through and you publish or write about articles in non-plastic surgery journals that are relevant to plastic surgeons. So journals like Annals of Surgery, and Science and all of that. You look through and see if there are articles that are relevant to plastic surgery. You write about, summarize them, and put them in the PRS journal. So that is a great opportunity. ASPS is doing a lot also now through the SHARE program. These are opportunities that residents can key into, learn from their colleagues. The world has become a global village. So because right now, when sometimes I'm seeing patients and they're sending me results or before and after results of doctors in Atlanta, in France. So you can't isolate yourself in a world that is so interconnected. So you have to be up to date in your training, know what is happening in Atlanta because the patients are demanding such results in the US, in Canada, and all of that. They send you pictures of beautiful outcomes from other places and say, this is what I want. So you want to find out how is this surgeon achieving this kind of results, and then you continue to push yourself to improve your practice and to give the best that you can. So ASPS is a wonderful body. There's also the ASPS International Membership for young plastic surgeons, and also which you can continue to resubscribe and grow in the practice. It exposes you to opportunities for ASPS fellowships that are available. So it's a wonderful platform for every young surgeon global aspiring young surgeon.
Do you think you can bring all these resources back home, like to help the future Nigerian residents to train to be like you?
Great. Yeah. So currently, like I talked about the skin tightening technique, which I learned a lot about in during my fellowship. Yeah. So we are now offering that procedure here locally. Also for residents, just the same way I was helped. Like I told you before, I finished residency. I was visiting and shadowing another aesthetic surgeon where I started my practice. So I'm also offering the same opportunities to younger residents in training. So in fact, I have a surgery on Monday, and I've already contacted one or two of them who would be available to help me assist and see what I'm doing. So that's another way of paying and paying back the favors and the blessings, I would say, that I've received from both the ASPS, SESPRS, and the entire plastic surgery community and the mentors I've had along the way. So I get them into my practice. They shadow me. I also had the privilege of we had the privilege of having an international, that is a U.S. plastic surgery resident who was visiting Nigeria for some research. She visited us briefly for a week or so, and she joined us in theater and all of that. It was a wonderful experience. We shared ideas, exchanged ideas on how to continue to improve and all of that. So it's been a wonderful thing, and I'm always happy to give back because I've also received a lot.
Yes, yes. I'm so happy to have you, Dr. George, to be on our team. It's like if we have like future Nigerian residents, then I'm sure we can direct them to you to for guidance. Yeah. You're
Definitely,
just the
yeah.
perfect example who survived through all this. So
Thank
I have like the final questions that I mostly ask most of the speakers I interviewed, which is like if you can go back to your first year of yourself, which was, I believe, like 8 to 9 years ago. Like, what advice would you give to yourself? Like, would there be something that you would have do more aggressively since now you have seen the full scope of what you have seen in Plastic Surgery Society, both locally and internationally, both reconstructive and aesthetic? Like, with your strategies or with your time planning, the way how you spend your time, because ultimately like this is a podcast platform that we are hoping to guide and educate our global plastic surgery residents. Like we are trying to be like you. We want to know how to get from a resident to being an aesthetic surgeon like you. So is there something that since now you have gone through 8 to 9 years of training, something that you would really change or do more aggressively, and what this all means to you?
Thank you very much. Thank you so much. So first of all, if I will go back, the first thing I will do is to I will be less anxious. Okay, that's one thing I would on the other side. Yes, because
I'm very anxious. I'm very anxious about my future.
yes, I will be less anxious. Having gone through it now, looking back, I now begin to wonder why I was extremely anxious at some point. At some point, I worried if I would be a good surgeon. At some point, I worried if I would be able to do the kind of surgeries I saw my attendants doing. I worried a lot, okay, whether I would turn out good, whether I was good enough, a lot of imposter syndrome along the line, but I kept moving. And I think it comes with years or years of training, doing the same things and being focused and grounded and having good mentors. One can continue to improve. So I'll go back. That's the first thing I'm going to do. Secondly, I'll also be, if I had the opportunity of being exposed to ASPS and all these international resources earlier on, I'll be very happy. So that's one thing I'm going to tell any person who is coming in, any young resident, get exposed to the available resources internationally, locally. I became exposed to this during the COVID, period when things were shut down. But there were a lot of activities, webinars, training webinars, both from ASPS, ESPRS, even from BAPRAS, that is the British Association of Plastic and Reconstructive Surgeons. It gave us opportunities to connect with people, from beyond Nigeria, in a very broad way for the very first time. So that was a very good exposure, even though it was happening during that period. So from then, I saw that there were a lot of resources, that there was help if you needed help, that you could mail, even mentors abroad and ask for advice and all of that. And it was an interconnected society globally that we can continue to learn from one another and continue to improve our practice. So I would say be less anxious and then expose yourself to international opportunities, learning opportunities, networking opportunities very early in your training. Thank you.
You do have to elaborate more, like how do you deal with your inner peace though, like since this is what you learn for 8 to 9 years of essence, like I hope to ask for global plastic surgery residents to you, like how do you keep going to push yourself while dealing with all this anxiety, especially, I'm sure there's some comparison with your colleagues, with your seniors, whether you are good enough, and all this overnight training and long procedures. Like, how do you deal with all these emotions?
Yes. So for me, I would say I'm a Christian, so I leaned in a lot into faith and praying and believing. There were times I had tremors and all of that while operating or trying to operate, just because of excess anxiety. These are surgeries that I would do, without, when I don't have, my very senior supervisors around. But once they are there, and this anxiety sets in, and you want to impress and all of that, I would say be calm, trust the process. Okay, everybody knows what you're expected to do as a first year, as a second year, as a third year. Nobody expects you to do a head transplant anyway. So just trust the process. Keep practicing. Okay, there are models now. I had to lean into a lot of simulations and suturing and all of that. Those are things that make you confident in the off theater setting, so that when you're in theater, for example, you are calmer and you can focus. Music also played a very big role. So playing music, jazz, and all of that in the room, and just also speaking to my seniors. I had to speak to some confidence, confide in some of my senior mentors who were very close to me. And we spoke about this, and they said, oh, they went through this. They were also anxious at some point, but I mean, it's nothing to worry about. Just believe in God, believe in yourself, and also have trust in the process, and you turn out better by the day. So it's a process of self improvement. Even as I'm still improving and all of that. So it's a continuous process, and we continue to get better by the day. So I think that was how I was able to go through those difficult times.
Yeah, well, like, how do you feel now, like after 8 to 9 years of all this? Do you get used to it, or do you grow stronger, like you don't feel it anymore?
Well, after a while, it's just like driving. Okay, I remember when I started driving, and it was really scary. And from the night before, I'll be thinking of how I'll drive the following day. So that is really the same way it is as one progresses. So, but now I don't think about it. All I know is the car is in good shape and everything is checked and good, and then I just go on. So for surgeries, I think it's almost similar. Initially, you may get a lot of anxiety when you're preparing for big cases. It's normal, but with when you repeat these things over and over again, that is why the length of the training is that maybe long, of 6 years, 7 years sometimes. So it gives you the opportunity to go through these cycles over and over and over again, so that you become more used to them, become like a routine, and you are less anxious, okay, over time. So now, because of these procedures, I've done them a lot of times. When I'm approaching them, I approach them with more of confidence. I go back a night before the surgery, go through the patient's notes. I go through their pictures, the before pictures. I review their history. I note things that I feel maybe things that would, anything that is of concern to the patient. That so I note all of that. If there's something that is not right, I discuss with the anesthetist, just to make sure that on the day of the surgery, everything is in good uh, form for the patient to have a smooth surgery. On the morning of surgery, it's good to be relaxed. I start my day early, about 5 a.m. I pray, I do some light workouts, have a light breakfast, and off to work. It's good to be at work early so that you're in control, you're not panicked, you're calm, and you're just doing what you know to do because you have been trained to do these things over and over again. So just trust in that process, trust that you have been well trained, trust in God also. I think you'll do just fine.
Oh my God, that's like a very, very good touch. Yeah.
Thank
Yeah,
you.
like because I think what you have done is you have speak out, like, at least for me, like how I feel as a plastic surgeon residents, like the
Yes.
anxiety that we face, the long hours of surgical procedures and many years of training and all this unknown future
Yeah.
path, and the anxiety, but then what you showed us is that now you are just the driver. You don't really think about the road anymore. You know how to drive, and
Yeah.
you control where you want to drive. And I think that sense of serenity and confidence really comes from years of training,
Mhm.
like years of solid training, like I
Yeah.
think that was a really, really nice touch. Like it gives a lot of faith to global residents.
Yeah.
Like whatever difficulties that you think you're experiencing right now, it's all gonna pass. It's just part of the process. Yeah,
Yeah.
just enjoy the ride. Yeah, I really thank you, Dr. George. And I think that will be conclude for the night. I will thank to global plastic surgeon residents. This is the new Chinese New Year, starting in 2026. Thank you very much for listening. I do want to say, if everyone or anyone who is interested in sharing your life story, just like Dr. George, if you want to be heard, then please feel free to reach out to us at aspsirfpodcastteam@gmail.com. Send in your story, then we will get you on the stage. I will say Happy New Year, everyone. I will see you after Chinese New Year. Thank you. Good night.
We hope you enjoyed this episode of the Enhance Your Practice podcast series brought to you by ASPS University. You can listen to our other episodes on any of the podcast platforms where they are currently available, or you can download recordings directly from ASPS EdNet. New seasons and episodes coming soon on practice management. Please contact ASPS Education with your feedback and suggestions for future podcast topics. Thank you for tuning in.